The coronavirus emergency, the death toll in the U.S. rising to 9, all of them in Washington state, as new cases appear in more parts of the country. We get more now from NBC's Miguel Almaguer.
Tonight in Washington state, the outbreak turning deadlier. At least 9 fatalities and more than 30 confirmed cases of the coronavirus. Emergency crews responding again today to the nursing home where several patients lived who later died after contracting the virus. Others are still hospitalized in critical condition. 26 firefighters who helped the sick are now off the job, many with flu-like symptoms.
This really impacts the community, right? Our ability to keep the community safe.
Across the country, in the nation's most populated city, New York officials confirm the coronavirus has infected another patient. Hospitalized in serious condition, doctors are now tracing his movements. The man, a lawyer in his 50s, who lives in Westchester and works in New York City, may have been exposed in the area. His family quarantined at home. 7 employees at his firm are being tested, and the schools his children attend are now being cleaned.
This is a crisis that will be with us, I think it's fair to say, not for weeks, but for months.
Fighting the virus and public fear, tonight there are more than 120 confirmed cases in a growing number of states. In North Carolina, their first patient, the person exposed after visiting the nursing center in Washington state. Back near Seattle, a government building closed as a public school reopened today after one of its students tested positive for the virus. 4 others being monitored.
I feel like I'm sending my son to death, basically. I mean, it's just unsafe.
Washington's governor saying the public should consider avoiding large events and assemblies.
We are not making a request formally right now for events to be canceled, but people should be prepared for that possibility.
Tonight, growing concern over the unknown, a deadly virus quickly spreading as health officials urge caution while trying to ease fear.
Some of the patients who tested positive for the coronavirus are being treated in the hospital behind me. They're in critical condition, fighting for their lives. Meantime, local officials here in the Seattle area say they're working to buy a local hotel to house the sick, a clear indication they expect those numbers to also rise. Lester.
Yeah. All right, Miguel Almaguer, thank you. We'll be right back with more breaking news on the coronavirus, including today's big move on the economy and the run on supplies. Now to that surprise from the Fed today, slashing interest rates to combat the economic toll from the coronavirus. President Trump saying the move is not enough and meeting with health officials as his response faces continued scrutiny. Hallie Jackson is at the White House.
A surprise emergency move.
The Federal Reserve announcing that it is cutting interest rates.
The Fed hoping to counter the coronavirus effect on the economy, slashing rates half a point to boost markets. But investors found little comfort. The Dow still closing down nearly 800 points.
It's a historic day here on Wall Street.
It's the first time the Fed has taken this kind of step since the 2008 financial crash.
Finally. Do it more. Do it a little bit more. The Fed rate is too high. It's very simple. It's too high.
President Trump visiting the National Institutes of Health today.
At least in the preliminary safety.
He's now hinting Japan might be the next country hit with new travel restrictions. And he's pledging to help the financially vulnerable.
For patients who don't have insurance, Mr. President, what should happen? Will your administration help?
We're looking at that whole situation. There are many people without insurance, so we're looking at that situation for those people.
Aid to help hospitals care for the uninsured is expected to be part of an emergency package that lawmakers have almost finalized. Set to spend about $7.5 billion on things like testing and vaccine development, production of emergency supplies, and helping states fight the virus. Vice President Pence on Capitol Hill with top experts briefing senators about the administration response.
The biggest question, testing. When and where? They could not answer how soon people would be able to get the tests.
I was assured they're going to get out the door. The bottom line is it seems to be that the testing element is going to get more robust by the end of the week.
And late tonight, the vice president announced the CDC will issue new guidance making it clear any American can be tested for coronavirus subject to doctor's orders, and that all federal agencies will be directed to review their own internal travel policies. Lester.
All right, Hallie Jackson at the White House tonight. Thank you. And with cases of the coronavirus now popping up all across the country, we want to take a closer look at what's being done to prepare for the virus. Officials, as you keep hearing, urging caution over panic. Let's get more from Tom Costello.
On this Super Tuesday, it's not just politics on the minds of some voters.
We will have hand sanitizers. We will have wipes.
Crowds and the coronavirus, too.
We have lost a few people that were hired to be election clerks at our vote centers that were just a little bit nervous about being around the public.
New York crews out cleaning buses, trains, and stations after 2 confirmed cases there. The government says it shipped 75,000 test kits to labs across the country. Though skepticism tonight, those labs will be able to process nearly 1 million tests this week, as the FDA chief promised. As more labs test more samples, experts expect the number of confirmed coronavirus cases to rise nationwide. With airlines cutting back travel to Asia and parts of Europe, the U.S. Travel Association predicts a 6% drop in international travelers to the U.S. over the next 3 months. Both Facebook and Twitter pulling out of the South by Southwest conference in Austin. Meanwhile, health experts across the country are suggesting all of us cut back on handshakes, on casual hugs and kisses. Hand sanitizers in churches now as priests urge parishioners to refrain from shaking hands or drinking from the same chalice.
We're not making monumental changes to things. It's just a few kind of tweaking it to be aware.
In Denver, someone stole protective masks meant for doctors, nurses, and patients at National Jewish Health. The hospital is now guarding its remaining supply and awaiting another delivery.
We've sequestered our masks that are around campus so that only staff have access to these masks.
With supplies running low, the World Health Organization says medical supply hoarding is now a problem as the virus and fear spread. Tom Costello, NBC News, Washington.
And as we continue tonight, the coronavirus's surprising impact on children. We're back now with a new warning from the World Health Organization this evening. The death rate from the coronavirus is rising, at least among known cases, as cases rapidly spread around the world. Our Richard Engel is in London.
It's spreading, and it may be twice as deadly as previous estimates. In South Korea, they're now screening and cleaning on a wide scale. In Iran, where dozens of government officials have been reported sick, prisoners are being furloughed. And Italy, 79 people now dead, all over the age of 63. Tonight, the World Health Organization in Geneva estimates the mortality rate has increased from around 2% to 3.4%.
COVID-19 is a new virus to which no one has immunity.
Some reassurance from America's top virus expert, Dr. Anthony Fauci, who told Congress most healthy people get better.
About 80% of individuals who get infected do really quite well without any specific intervention. Namely, they spontaneously recover.
More from Dr. Fauci on NBC last night.
Is that what this is going to become? Is this going to become a new seasonal thing
We don't know.
that we're just going to have to deal with?
I get asked that question constantly, and the answer is we do not know. The way it's acting, the facility with which it transmits from person to person, makes me believe that it's not going to be a one-off. It's not going to be this season, when the season is over, we're done.
Richard Engel, NBC News, London.
All right, let me bring in our chief medical correspondent, Dr. John Torres. For one of the questions that's been gnawing at me is, why aren't we seeing this sickness in children on the scale we've seen in adults?
And Lester, studies from China have shown that children account for less than 3% of all cases. And for those who are diagnosed, the vast majority only have mild symptoms. Now, the reason may be that children's immune systems are constantly fighting off colds, which are a type of coronavirus. So kids may have built up immunity that helps them fight this particular strain of corona. Now, it is important to note that even if children are not sick with the symptoms, they can still spread the virus, so they need to practice good hygiene. Keep washing those hands.
Dr. John, thank you. Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.